Today we will be talking about hyperthyroidism. So, what is hyperthyroidism? It is the opposite of hypothyroidism. So, in my earlier video, I have already explained what is hypothyroidism, where the secretion of thyroid hormones is reduced. So, of course, hyperthyroidism is where the secretion of thyroid hormones is increased. Now, there are multiple causes why this thyroid hormone secretion is increased. So, the commonest cause is an autoimmune disorder. Autoimmune is a process wherein the body recognizes its own glands, its own organs as foreign substances and starts reacting or attacking the cells of these own glands, and that causes the disease, and this disease is called Graves' disease. Another very common cause of hypothyroidism is the inflammation of the thyroid, which is called as thyroiditis. Pregnancy also seems to cause hyperthyroidism in pregnant females. Pregnancy induced hyperthyroidism is very common, and here the thyroid levels come to normal once the lady gets delivered. The other causes is when a person is under treatment of hypothyroidism for a very long period of time without monitoring the thyroid levels. So, such a person who is under treatment of thyroid norm, the state fluctuates between hyperthyroidism and hypothyroidism. So, this is another very common cause of hyperthyroidism. Now, what are the signs and symptoms of hyperthyroidism? Unintentional weight loss is one of the commonest symptom of hyperthyroidism, and many times an observer, a relative, or a friend helps the person to notice this unintentional weight loss in this person. The another very common symptoms is the bulging of eyeballs. Other symptoms that we see in hyperthyroidism is intolerance to heat, tremors, chorea, confusion, irritability, intolerance to heat, lot of sweating, because there is high of metabolism. So as I already mentioned, there is loss of weight with normal or increased eating habits, and there is bulging of eyeballs. There are many other symptoms also that develop, and it may vary from person to person. Now, what is the treatment for hyperthyroidism? So there are, in allopathy there are three modes of treatment. One is to give the iodine radiotherapy. Second is to give medications, and the third is surgical removal of the thyroid gland so that the secretions of these thyroid hormones is reduced. People do follow can follow any of these treatment modalities as per the advice of the treating physician. People who generally undergo surgical removal, which is an eventual treatment, they again suffer from hypothyroidism, because of course the thyroid gland is partially excised, and so the thyroid hormones now are secreted in a reduced quantity. So such person have to take a lifelong treatment for hypothyroidism. Now the best treatment modality for hyperthyroidism is homeopathic medications. If you start with homeopathic medications at the earliest or at any point of time, it is very easy to control this hyperthyroidism with homeopathic medications under the guidance of a good homeopathic physician with regular follow-up. And this follow-up should include a regular measurement of or regular investigations of T3, T4, TSH levels at 3-month intervals, so that the medicines and the disease process can be monitored and controlled by the treating physician. Yes, as I already mentioned, hyperthyroidism, like hypothyroidism, is treated and can be completely better with homeopathic treatment under the guidance of a good homeopathic physician. These medications are absolutely safe in all age groups. They are non-toxic, they are non-habit forming, and once your thyroid levels come to normal, then the medicines can be stopped. So there is no lifelong dependency on these medications, unlike the other modes of treatment. So, if you want to get free from hyperthyroidism and hypothyroidism, the best mode of treatment is homeopathy. Any queries on this, do write in the comment section, and I would like to uh, reply to all those important questions, health related important questions that come up on hyper and hypothyroidism. Thank you.